might be home, residential care, respite care, palliative care, and somewhere else. Just one moment. Anjali, you keep the time. Okay. By 20 minutes, make my this talk over. So, discharge planning by definition. Discharge planning is the process of transitioning a patient from one level of care to the next. Ideally, discharge plans are individualized and instructions are provided to the patient as they move from the hospital to home or subsequent healthcare provider, or as they move to a long-term care facility. It's not like that each time, every time you are going to discharge the patient to the home. Sometimes he can need a discharge from your IPD to more acute status. He has developed some certain complications. Like today, we have just shifted a patient from our ward to this this IPD, general medicine IPD. Because patient was regularly, periodically developing this hyponatremia, we tried to correct it. Today we observed the crepes have grown more, crepes are more severe and slightly a bit obtended. So we were not able to discharge the patient to the home. In fact, we not discharge. We transferred the patient to the medicine IPD. And before this transfer, we need to counsel, convince the caregiver, the parents, why we are doing this and why it happened. So this is an interdisciplinary team that will address together their patient discharge time. The team will provide a comprehensive evaluation and treatment plan to facilitate the patient community reintegration. And every discharge plan is different. It reflects a patient's unique personal and social situation. Recovery from an SCI takes months and even years. So it's not a one-stage solve. You are coming here, you have been admitted here with certain goals. Might be short-term goal and long-term goal. Now few goals we are able to achieve. Now again we are discharging and sending you back home with proper instruction to be followed, and after discussion with your family member how to be taken care of at your home by yourself or your caregiver. But again we are reassuring you at the same time you are welcome to our setup at any point of time, either you can continue through telemedicine or you can come here. Again we will reevaluate and again you get admitted here for further goal and plan. So roughly in 3 categories: from home to home-based rehabilitation services, to an outpatient therapy program or day program services, or discharge to another facility. What is the goal of discharge planning? This is to improve patient quality of life by ensuring continuity of the care, reducing the rate of unplanned readmission or complication, and decreases the financial burden. So many government schemes are there in place, but still, whenever you admit a patient and you tell them it's going to cost 250 rupees every day, at our IPD it costs 200 rupees per day, including 3 times meals, all the therapies and everything. But still, EMR IPD is the most cheapest IPD in AIIMS Patna, despite being everything payable here. But we have kept it a rate decrease. We are not able to make it free. So it's a huge financial burden for a patient because you are providing meal only to the patient, not the caregivers. They are again going outside, taking their food and meal from the restaurant, dhaba, Italy, whatever it is. And one meal costs more than 100 rupees, 150 rupees. Even if they take a room outside, it will cost almost 500 rupees per night. So, being a physiatrist, you must take all these things under your consideration. It's not like that how you are feeling and what is going every day. You must ask the caregiver. Actually, many times we ignore, we never ask caregiver, how are you? Have you eaten your breakfast? Have you taken your meal? How are you feeling? Not only talk to the patient, you talk to the caregiver. He is standing by the side of him or her. Okay, he is standing since 1 month. And you never talk with him. It's very surprising, no? He is a human being, he needs a human touch, human concern. So sometimes you ask about him, how are you feeling today? Okay, are you, this hemoglobin level is okay? If you need any medical care, you can consult the OPD. In our institute, every department is here. Because you need to take care of yourself only, then you take care of your patient. Who are involved in hospital discharge planning? Okay, so everybody in fact involved. All the caregivers, all the rehabilitation team, nursing staff. Actually, there is only one person. In our wards, actually we are planning to do it, coordinate through senior resident who will do the discharge planning. I have not done yet, but we are planning to do it. What is included in discharge planning? You must write and take into account all these things like follow-up test and appointment, whether the person leave alone, whether someone can help when she or he go home, his mobility, equipment needed for the recovery, wound care if needed, medicine especially if multiple medication needed, dietary need, continued rehabilitation. So you think that all of a sudden in the morning you cannot say patient, we are going to make you discharge. You consider all these things, write it clearly, convey it clearly, and make sure patient has understood these things. Decision of discharge. If the individual no longer require overnight nursing, safe, defined by the team, your rehab team, an appropriate environment to live after the discharge, required equipment, assistive devices have been provided. The individual has the physical or verbal ability to direct or manage care. Function can be maintained or improved further in the community. I know all of you have faced this situation. When you are discharging the patient are crying in front of you, sir, no, we don't want to go home. At least you give us a wheelchair. How could we negotiate at our home if we don't have a wheelchair? We don't have the money to purchase a wheelchair. At AIIMS, we have adopted this EDICA scheme after a lot of hurdle. You can understand, between two ministries, we negotiated this Ministry of Social Justice and Ministry of Health and Family Welfare. We all know how difficult it is. And we got a grant of 65 lakh rupees. And recently we got equipment of 27 lakh rupees, which many of we distributed in the Disability Day. But now we have money, we have equipment to give free of cost to the patient whom we are making discharge after facilitating rehabilitation. At least we have something to offer them. They don't have anything to buy, but we have something to offer them. So there are means and medium we need to adopt at our institute. We need to make a lot of effort regarding this. It's our duty basically, it's our duty. Discharge determinant. It basically needs to be incorporated in the decision tree. It is as a reference tool to guide discussion at weekly team meeting and ensure consistency in discharge decision making. At least in a week we can plan what to do with this bed number 13 or bed number 14. Sir, we have achieved this short-term goal. Can we discharge? And your faculty consultant will tell you, okay, let me see, and we can discuss together with the therapist and everyone what is your opinion. A collective opinion can be made regarding the discharge. Successful discharge. The team, patient has made the goal established on admission or during rehabilitation. The patient has reached her maximum potential benefit from inpatient rehabilitation. And discharge to different environment is appropriate as the patient needs may be safely made by caregivers in the family or local community. These are successful discharge. Discharge summary, you have to make when you are admitted to the hospital, the main diagnosis, the test, what care you do receive, which medication the patient is taking on discharge, which other medication he had taken in the past, which medical or surgical procedure was performed, any allergy or bad reactions, a clinical summary of your situation now and follow-up action, which future services have been arranged, such as community services, and follow-up appointment that have been made. So you know, discharge, making a discharge will take almost 3 to 4 hours. Completion of discharge planning. Okay, provide necessary equipment, safe discharge destination, follow-up appointment. And these are the providing support in preparing for the discharge. Communicate with the family, patient, members, carers. Manage expectation and avoid misinformation. This is very important. Avoid misinformation. Don't misinform them. Tell truthfully what you can do. And if you want to, if you have hope or you know something can be done better somewhere else, you are free to go there. You can facilitate in going them there. Answer question and provide information honestly within your knowledge. Do not speculate and avoid being overtly optimistic or pessimistic when discussing information or further investigation, diagnosis or prognosis. Ask if there are any other questions. Include a clear point of contact for providing information to the patient, your family members and carers. Make eye contact. If possible, ask the patient if they want someone with them. If the patient agree, invite their family member, carer or friend into the room, but ensure that they are accompanied by a member of the staff and their presence does not affect assessment, diagnosis and treatment. This is a type of discharge. There are many discharge, lama, dama, many discharge. This is just one I have given here. And now unsuccessful discharge. It's not like every goal you will need to make. Sometimes goal need to be abandoned. Similarly, this is unsuccessful discharge. The rehab team has reached a consensus, but the patient is unwilling or unable to participate in the rehabilitation program. The hospital reserves the right to discharge individuals who violate policies or who decline to participate in the agreed upon plan of care. The patient has not demonstrated evidence of improvement in functional abilities in her clinical status, and the overall personal goal of the patient program has changed so that the residential program is no longer the best use of a personal resource. To accept gracefully your failure or your planning failure or your team failure. Accept it, respect it, and make a decision of unsuccessful discharge. There is no shame in it. Discharge with subsequent transfer. Okay, if anything we need to discuss, we can discuss, but I don't think you have left any energy anymore because we have a very interesting one more lecture with us. So, thank you. So we have next our speaker, Professor Dr. Sanjay. Sir, please come here. I think